But let's focus on healthcare global enterprises. The operational improvement has continued for the company. In fact, margins are at the best level in the last 6 quarters. To discuss this and more, we have BS Ajai Kumar, who's the executive chairman of the company, who joins in now. Mr. Ajai Kumar, always good seeing you on the channel, and thank you for joining in this afternoon. It's been a good quarter for your entire sector, but for you particularly, the ARPOBs have gone up about 8% year on year. Margins have improved. Just give us a sense of which way things are headed, right? In FY25, what kind of growth are you envisioning for the business?
I think we are expecting a significant growth, primarily because of the consolidation period is over. Now, as we know that places like Calcutta, Mumbai are beginning to ramp up significantly. And because of this and the fact the Kolkata center is broken even and growing quite well, so also is our Mumbai region, including our South Mumbai, which is growing well. All the centers which are mature and also new centers are ramping up. Because of that only, you are seeing significant improvement in the revenue as well as improvement in the margin. We are focused on margin quite a bit now, as we have said in the past, and that is beginning to show the results. Even our PAT has shown an improvement, and I think all of this are sustainable and we will grow significantly in the coming quarters, primarily because of the ramp up which is happening in our existing centers.
So if you could give us a sense of 3 numbers then, Mr. Ajai Kumar, the first one is what are the kind of margins that you're expecting in all of FY25? Because this quarter, the margins were the best that we've seen in the last 6 quarters. So what's sustainable? The second number is what is the ARPOB that you're penciling in terms of growth for the next year? And the third one, of course, would be the occupancy. So occupancy, ARPOB and margins for FY25.
Now, as we know, as far as the margin is concerned, I think the fact the mature centers already have a margin over 21%. I think our goal is to catch up with the 21% with the non-mature centers also ramping up, which are now at almost at 14%. So I think in the next 2 to 3 quarters, we will see upside of this margin. And my hope is that we will be reaching close to 20% margin towards the last part of the year. Regarding the ARPOB, I do see a significant ARPOB growing. One of the most important things we have seen, even the tier 2, tier 3 cities are showing good ARPOB. The mature centers are ARPOB of 42.5. Now the non-mature are catching up. Now there will be a growth of ARPOB from 42 onwards. I think we see another 8 to 10% growth going forward. Regarding the occupancy is concerned, we are very happy with the occupancy of nearly 65%. And I think the occupancy is going to increase. And our expected occupancy will be somewhere closer to 70. But the most important thing to remember is more than bed occupancy in oncology, it is the footfall. Because a lot of oncology is outpatient and that is ramping up very well. That is shown by the fact we are installing more linear accelerators. We have today 36 linear accelerators in the country and it is increasing. All of that shows a significant growth coming forward.
Okay, so that's on the business which is picking up quite a bit, right?
Yes.
Okay. I also wanted to understand a little bit about what's happening with CVC Capital. CVC Capital currently holds about 60.4% stake. And I know we always ask you this question, but I have to ask you anyway. Any plans on them exiting? What's the future plan with CVC?
I think as far as we are concerned, our board is concerned, we have not had any offer come from anybody on the table at this point. But as I always say, the best thing would be to ask the CVC to give an answer to that. So I will not be able to comment anything more on that. But if there is any news, obviously you will definitely hear it.
I'm sure you are in the know of things, right? So I just want to understand, is there any truth to this report that Temasek may be bidding for the stake?
No, I really cannot comment. I doubt, but I cannot comment.
You cannot comment on whether you know Temasek is bidding or you have doubts on Temasek having bid?
I have doubts on that, but that's all. I would like to end it. Okay.
All right. So, okay, because something was brewing and it's there in all the papers, every, publication which tracks these deals, etc. If not Temasek, I'm sure there's never any, smoke without fire. So wanted to understand whether there were any conversations that were underway, not necessarily Temasek, but someone else as well.
I have not had any contact with Temasek.
Okay. And others?
As I said, I don't want to comment. As far as our board is concerned, we have not had anything in terms of offer and no indication. And I am sure if you approach CVC, they can also clarify on this.
Okay, we'll try and get some details from them. But I'm sure if and when anything happens, we'll be the first to know. I hope so. So getting back to the business, sorry, you had a question?
No, I just wanted to know that, if there is an exit, if at all, and I'm sure at some point there would be, it's not a question of if but when, what would be the best course of action? Would it be a strategic investor or would it be a financial investor? Because if it goes to a financial investor, then, there's again this overhang of them exiting at some point.
No, you are right. And I think I will, as far as a founder I am concerned, I'm going to keep an open mind. And if and when that happens, certainly I will discuss. And of course, even in CNBC, I will certainly give my views on that at that time. But I will definitely keep an open mind.
Okay. Coming back to the business then, I guess, that's something that you can tell us a little more about. How did some of your key regions like Bengaluru, Kolkata, Mumbai perform in this quarter gone by? You have a 30% market share in Bengaluru, which is your home market, right? What kind of growth do you hope to see there? And what is the overall growth in these pockets?
See, Bengaluru, we are very honed in on Bangalore. We want to be a dominant force in Bangalore. That is our center of excellence. And it is growing significantly. But most important thing is we are also establishing a center in Whitefield and North Bangalore. With this and the infusion centers we have in Bangalore, which we hope to be at least close to 38 to 40% of the market share in the coming years in Bangalore. That is our goal. As far as Mumbai is concerned, as you know, the two centers in Mumbai are doing very well. When you combine the two centers, they are really a center of excellence with high technology in South Mumbai, with CyberKnife and tomotherapy, as well as in Borivali, high-end therapy with bone marrow transplant. All of this, and it's excellent doctors. We have doctors who are well-trained in subspecialties. All of this is going to make Mumbai a center of excellence for us, and the growth trajectory is good. We also plan to open several infusion centers in Mumbai in the coming months. So with all that, we want to be definitely an oncology dominant player. We know Tata Memorial is there. That is an autonomous government public sector, but in private, we intend to be dominant there. We are already reaching up to that level in our radiation therapy load. As far as Kolkata is concerned, as I said, we have definitely done well in the last quarter. We will continue to ramp up, particularly now we are going to see some international patients from Bangladesh. And we are now slowly becoming well-known center in that area with HCG brand, doing complicated surgery. We have also established robotic surgery there. So we see significant growth happening in Kolkata and surrounding area in the coming several quarters. And we will also establish, as we said, our model is to establish spokes with multiple infusion centers there.
All right. And what's the, targeted expansion plan in terms of the beds that you plan to add this year and the next?
I think what we want to do is to really, sweat what we have assets significantly. For example, Cuttack is an amazing place where we are investing to further growth in Cuttack, as well as I said about Mumbai and Bangalore. And Ahmedabad is an area where we have almost doubled the bed strength, and significantly it is going to grow. So these are the areas we are focusing on this year to grow significantly. But we are also looking at like what we did in Indore, a target we acquired. We are looking at other M&A targets also. We are in the process, and once we decide on something, we'll certainly make an announcement.
All right. Thank you so much for joining in. Once you've decided on an M&A, you will make an announcement. Once you've decided whether who acquires you, you will perhaps make an announcement then as well. Until then, we will, live with the 60-65% occupancy going to 70%, 8 to 10 ARPOB growth and margins veering towards that 20%. Wish you good luck, but more importantly, wish all your patients good luck with their health as well. And we hope that, the kind of work that you're doing for society is great. Thank you for joining in.